Okay. Can you see it here? The
Mhm.
title page? Good. Okay. All right. So yeah, thanks for inviting me. This is I'm excited. It's been a while since um I've got to see, Gene and some of the other people here. So it's good that I'm glad that you guys invited me to this. So first, what I'll do, I'm going to give you a little bit of background about myself. Then I'll talk about my volunteer experience at the hospital as well as other organizations that I've been a part of. And then I'm going to end up talking about ILI telemedicine, which is the university's respiratory telemedicine clinic that we created back when COVID hit the community. So to get started here, first I just want to give you guys some background on my education. So um, I got my bachelor's of science degree in biology at the University of Iowa. I graduated in 2008. Um, I took a few years off in between PA school to get some more healthcare experience. So I was a nursing assistant for 2 years at the University of Iowa. Most PA programs you need just experience with patients, hospital experience. So I took 2 years off in between undergrad and graduate school and was a nursing assistant. Then I got into a PA program in Fort Wayne, Indiana. The name of the school is University of St. Francis. Their master's program is 27 months, so I was there for just over 2 years. Then I moved back to the area because I'm originally from West Liberty, Iowa, so not too far from Iowa City. Moved back here in August of 2012, and I'll go into my job, but got on at Quick Care. But recently, over the last year, I've been going to school for a postgraduate certificate. So it's through the UI College of Nursing here at Iowa. And specifically what this certificate's for is it's health systems and administration, and it's geared towards APPs. So as I'll explain in my PowerPoint here, that over the years, my leadership position has changed and more evolved. So over the last year when I started doing this certificate program, this is definitely the route I see myself going, is continuing kind of in this leadership role. So this class has been great, or this program has been great. I have one more semester to go, so I have 2 classes next semester, and actually last night it wrapped up my 2 classes for this semester. So kind of nice. It's finals week for me as well, just getting done with that. So as I know, a lot of you have been doing your virtual um, learning as well, and finals are wrapping up this week. Okay, so moving on, my volunteer experiences. So during my time at an undergrad at Iowa, in 2004, I started as a hospital volunteer there with the clinics there. So, and I was on quite a few different units during my time. So 4 years, 2004 to 2008. So GI surgery and trauma, the family care clinic, the MICU, and physical therapy as well. And as during the course of that, so in 2006, I was enjoying this, and I knew at that time I wanted to go into healthcare. So I thought, leadership would be a great opportunity. So I applied for the College Student Leader Board, and got on. And initially, my first year, I was with the GI surgery and trauma team. And then my second year, my senior year, I was with the MICU. I was the lead there. So that was definitely a great experience. It was prior to that, I didn't have a whole lot of leadership in organizations, I guess, in college. Like, this is kind of my first big step at that. So, volunteering kind of showed me the way and kind of helped me grow there. The student leader board was great. I got to work with other volunteers. So I want to say it was like maybe 20 to 30 different students, and maybe it was even closer to 40 different students. It kind of coordinated their schedules, and then also worked closely with the different nurse managers on the units to see, what we could do to help them out in those settings, which I know it's been a lot different for you guys over this semester and this year with you guys having to go virtually. But yeah, this was a great experience. I learned a lot. We had a good student leaderboard team as well. There's a lot of other nursing, medical, kind of healthcare related students that I know went on to other healthcare careers. So as I was talking to Gene earlier, I knew one of the Mark Dubé, he's another fellow PA of mine, knew him pretty well and worked with him for quite a few years now. I've worked with him at the University of Iowa as well. So great experience. I learned a lot through this. And yeah, we'll move ahead here. Another organization I played a large role in was UI Dance Marathon. So I did this for 3 or 4 years as well. I started off as a dancer. I think it was my sophomore year I started as a dancer and really enjoyed it. So if you guys aren't familiar, so UI Dance Marathon, it's college students. We fundraise. There's a group of us. We fundraise. Really, we hold events throughout the year for children at the hospital through now it's Stead Family Children's Hospital, but and with this, yeah, so we fundraise, we have activities throughout the year for these children, and then there's the big event is usually in February, where it's 24 hours where you kind of dance, keep your spirits up. They have lots of activities at that, and as part of this, so I enjoyed it my first few years as a dancer, so then I moved on to a more of a leadership position. They're called morale captains or morale captain assistant. I was that as well. So that was definitely fun. And there's a few pictures. There's a picture of me here. I'm in the red on that one picture, and everybody wearing the green shirts. Those are some of my dancers. The year I was a morale captain. I also met my wife through here, Ashton. There's a picture of us at a football game. So that was kind of exciting. And Ashton's she's also a fellow SLB student leader board member as well. She was very involved in Dance Marathon and was the hospital director her senior year. And so she was on the board, the student leader board as well. So yeah, so a lot of fun. I can't, still to this day, Dance Marathon, definitely, did a lot for me. And just the friendships that I built with that and just volunteering my time. It's really, I enjoyed that a lot over the years. Definitely another big moment, I guess, in my volunteer history, when I was in PA school, so 2010 to 2012, my program, we decided to go on a medical mission trip. And we decided to go to Haiti that year. So we took a week off in March of 2012, and there was, I think, probably 12 PA students. I think there was, I want to say 6 PAs and then probably 5 physicians that went with us and a pharmacist as well. So a pretty good team. I think there was probably 20 to 24 of us total. And we took quite a few medical supplies with us, different medications, and we went down to Port-au-Prince, Haiti. And this was, although it was 2 years after their earthquake, so their earthquake was in 2010. You guys probably remember reading about that. It was really devastating to that state, or to that country, excuse me, and particularly Port-au-Prince. And there's a picture on here of one of their national buildings. And this is even 2 years out. So it's definitely, this is definitely a country that was hit hard, and, they don't have all the resources. So even 2 years out, when we went down there, the population down there was very grateful for us. And there's a few pictures here. One is some of my fellow PA students, interviewing some patients as they come in. There's also one of the pictures on here is with me with, he was a pulmonologist that came down. And the other guy, there's one of my other PA colleagues as well. So this is a good experience. It's definitely eye-opening. It's kind of one of those things you don't know. Living in the United States, sometimes we take for granted, the healthcare that we have here. When you go to one of these countries, like even like Tylenol or Tums, like they appreciate it so much, stuff like that, because it's not readily available. So we took down a lot of medication with us, and even just kind of well visits where patients would come in, and we just kind of talked to them about things. So it was good, very good experience. And yeah, hopefully in the future I'll get to do another mission trip at some point, because I enjoyed it very much. Okay, some of my professional experience. So in 2012, so when I got done with PA school, I moved back to the area here and got on with UI Quick Care, which what these are walk-in acute care clinics. So we currently have 4 locations in the Johnson County area. Patients come in for acute illnesses, injuries, kind of see for a variety of different things. And really our goal, or what I do as a physician assistant, so I'm able to, treat patients, so I can treat them with medications if need be. get them where they need to be, so ordering tests, procedures and whatnot, and then get them the follow-up that they need. So the nice thing about working within the University of Iowa is there are a lot of great resources. There's, different specialties that we have here, family medicine, internal medicine, pediatrics, where we can bring in a lot of people from the community, and we do that a lot in quick cares. We'll all see them kind of for their acute needs, but then I determine, yeah, you don't have a family med doctor. Let's get you signed up one. So we'll get them a follow-up as needed. So yeah, and I've been doing that ever since. So 8 years now, just over 8 years I've been at Quick Care. So definitely been a great time. I've enjoyed my time there. And that kind of leads into my next role. So about 4 years ago, I took on a role as a lead provider for these clinics, and lead APP, I guess, is my designated title. And so what APP stands for is your Advanced Practice Practitioner. And this would be nurse practitioners, PAs. There's also, like at the hospital, they have CRNAs, and there's some other providers as well that kind of fall into this category. But for quick cares, mostly we have physician assistants and nurse practitioners. And really these clinics, these are the providers in these clinics. We don't really have any physicians on site. We have a medical director. Her name's Dr. Katie Borick, but and she's kind of our go-to. If we have questions, we can reach out to her. But really we're the ones making the medical decisions and really taking care of the patients. So yeah, since 2016, I kind of split my time. I spend a few days in the week seeing patients, and then the rest of my time's more this administrative role. So hiring new providers, onboarding, kind of getting them trained up to their compliances and privileges at the hospital, and really supervising them as well. So we have about 30 APPs with our quick care clinic, so quite a few. And my newest, back in March, so really when COVID-19 hit the community here in Johnson County, it was March 10th, was roughly around that time. Our team, so UI Quick Care clinics we're University of Iowa Healthcare, but we're also under the outreach clinics, which are called UI Community Clinics. So we were really tasked with, how are we going to take care of patients in a safe setting where, because at the time we just didn't have very much PPE available to us. We didn't know much about the virus as well. And the public was scared. I mean, for good reason, pretty much everywhere, things shut down, people were scared to come anywhere. The ERs slowed down significantly. I have quite a few colleagues that I know there that they're like, yeah, it was just it was eerie how quiet the ERs were even at that time initially. So we were tasked to kind of come up with a telemedicine model. So how can we really manage and take care of patients, from afar, where they can just log in from their computer, smartphone, tablet at home, and we'll get on video and talk to them in person, or just even calling patients as well, just talking on the telephone with them. So we worked with multiple different departments within the hospital system to really get this done. So the Epic build team. So what Epic is, that's our EMR system that we use for, charting on patients and really the schedule. They were really helpful with this. We have what's called the HCIS, or Health Informatics team as well. They helped us put together kind of these video platforms because really nothing had been like this had been done on such a large scale in the past. Now, there has been remote telemedicine for years in some of the outpatient clinics. I know like psychiatry does it regularly in some of our other clinics. So our actual build team had something to start with, which was nice. But when they kind of tinkered this around, they catered it to what we needed for this. And really then initially, I was definitely one of the first ones helping with this, but also our quick care providers, our urgent care providers that we have. So nurse practitioners and PAs started helping with these visits because, as you could imagine, those clinics all significantly slowed down. So our volumes went from 50 patients a day down to maybe like 10 patients a day. So we really needed to give our own providers something to do as well. So the majority of them, we put them on these telemedicine, and what we did was we opened up appointments where patients could call into the university. They talk to members of the PAC, or it's called the Patient Access Center, and they get them a time scheduled. Me being a PA, I follow a large list of, patients that need to be seen for the day. I go in, assign myself to a patient. Let's say it's 10 o'clock. I call them up, or if it's video, there's a way we log in through our computers, and that patient will know that that's their time. So at home, they'll be on their computer and they can log in. I go through a visit with them. I mean, similar to how a visit would be, in person. I get their history, kind of figure out what their symptoms are, what needs to be done. It, with obviously the differences, I can't do a full physical exam. I can't listen to them in person, or their lungs and heart, but still get somewhat of a physical exam. I can see how they're doing. If they can give me their vital signs, I could do. They can give those as well. And really determine, do they need to be tested? Because that's one of the big components of this telemedicine, is we determine, do they meet requirements for testing? Were they exposed to somebody? Are they having symptoms of COVID and we need to get them tested? And then, so as the provider, I'll kind of determine that, and then appropriately get them scheduled for something. The other component to this telemedicine has been really taking care of the positive patients as well. So the COVID positive patients. So we'll get them tested, but when we find out that they're positive, we call them with the results. And then what we do is we get them follow-up care. So it might be daily, it might be every other day that we call and check in on them or do a video visit. So really monitoring those patients over the course of their illness. So usually the COVID illness is about 10 days. We say they need to be in isolation for 10 days. So we'll see them multiple times over that course. On day 10, we see them for kind of the last time and determine, are they feeling much better? Like, are we able to release them from our care? So that's definitely been part of it as well. So in addition to all of that, I know that's a lot to take in, guys. We've had to reach out to other departments because we've just needed the help with this. So it's been pretty fun for me because I get to train other, not just APPs. So I've got to help train physicians, fellows, residents, from multiple departments. So peds, internal medicine, family medicine. So I've really got to learn to know a lot of people through this, which has been great. And as just kind of a side note, we've hired on dedicated telemedicine providers. So almost 20 that we've hired on in the last 3 months. Quite a few started in October, but so we've hired them on to really help with this effort over the next year. So that's been definitely another part of my role recently. So I've talked a little bit about this, but we'll go into a little bit more here. So yeah, the respiratory telemedicine, huge collaborative effort, because we wouldn't be able to do this and manage the amount of people that we have if we didn't have the Epic build team and really our HCIS team, because they're kind of the behind the scenes people. They're the computer people that know everything there is to know, setting up these video visits. And also the PAC, they've been another great resource, getting these patients scheduled. And over the course of these last 9 months, we've just made things even more efficient. We now have a way on there when I get done with the patient and I put in an order for them to be tested, they can go and actually through their My Chart actually book the time that they want to go get tested, which saves us because it's less calls the PAC has to make. The PAC they're busy with patients calling in, so we've helped them significantly as well. Over the course of the last 9 months, so we've actually seen over 70,000, and this number, it might be a little higher now, but 70,000 telemed visits, done over 80,000 COVID tests through this, so pretty good volumes. I mean, this is a lot. Just a little more background. So we've, for the longest time, we were seeing anywhere from 300 to 400 visits per day. When the University of Iowa students returned to campus back in August, we saw quite the surge. So we definitely, and you guys probably heard about it as well. So quite the surge. So we got student health. They I helped get them, some of their providers trained as well. We got them going, and they actually used a lot of our platform as well for this. Then we kind of slowed down. I think people were good about social distancing. Our numbers were declining, but after Halloween, we saw quite the surge as well. And the week following Halloween, our numbers jumped significantly, and we actually had to pretty much put an ask out to all the departments, where getting help from, internal medicine, families medicine, peds, and we actually ended up reassigning some of these providers to help us because there were so many patients calling in, and we needed to take care of them. So we jumped from 400 visits a day all the way up to I think the highest we got was like almost 1,100 visits per day, which is pretty significant. We had that for a few weeks where we were around 1,000. Around the week of Thanksgiving, but we started slowing down, which has been good. And we haven't actually surged at all since Thanksgiving. We've actually still been on the downward trend, which is good because we were worried after Thanksgiving, people going home, being around family and whatnot, that this illness could spread easier. We haven't seen that, so knock on wood, hopefully it doesn't happen still. So definitely encourage you guys, which I'm sure you guys are good about it, but practice your social distancing. The masks are important as well. The next 3 slides, I just want to show you guys some of the numbers that we've recently seen. So definitely we're in a good trend here. So the downward trend. So 12/15, which would have been 2 days ago, we saw actually less than 50 positives that day, which is good because even like last week we were up closer to 7.5 back on 12/9. So you'll kind of see here on the weekends we usually dip down. We don't have as many positive numbers of COVID patients on the weekends because our volumes are also lower on the weekends. But heading in the right direction. I mean, and you guys may have seen too on the news that things are on the decline in the state of Iowa, which is good. This slide just kind of shows the recent positivity rates. So this would be out of all the patients that we're testing, like what percentage are actually positive. So we're at about 15% now for patients that are coming in, they're having symptoms, which is good. That's definitely downward as well. At one point, back when the the college students came back, the campus, it was kind of crazy. It was, and this was also on the national news at that time. It was like a 40 to 50% positivity rate, which that has definitely come down. But over the last few weeks, 15% is looking good. We were quite a lot higher. I know some of the local counties, I think Jones County was upwards in the 40s back after Halloween. So these numbers are good too. They're telling us that, people are trying to be safe, and it's not spreading as quickly. This slide just kind of shows the number of visits per day. So recently, back on 2 days ago, we were actually under 400. And actually yesterday as well, I think we only had like 350 visits. So we also like these numbers are good. So 12/7, we were around 600 visits. We're kind of going down, which is good to know, especially coming into the Christmas time. We were worried about that post-Thanksgiving surge, but it really hasn't happened. So hopefully that means less people will be getting this around Christmas time too. Okay, finally, I just wanted to show you guys, so my family, so this is my son Brooks. He's 2 years old. There's a few pictures of him on here, little redhead. And there's my wife, Ashton. We recently had some Christmas photos taken, and this was his 2-year photos. So yeah. Okay, that is the presentation. And sorry if it went a little long. Definitely we can answer questions now, but.
Absolutely. No, that was great. You shared a lot of information that I'm sure our volunteers, this is the first time they're hearing. So let's go right into the questions. So how did you figure out what you wanted to do, and did your volunteer experiences have any influences on your decision to become a PA?
Yeah, so when I went to college, when I got into Iowa, I knew I wanted to do something healthcare initially. So I was actually thinking more the pre-med route initially, but I think during my time as a volunteer, on the hospital, the different units that I was on, really I got to see what other people did. So I learned about PAs, nurse practitioners, physical therapists, and I determined, maybe med school wasn't for me. So I went more the PA route. And for a while, I was actually thinking about physical therapy, but PA just kind of suited me a little bit better. So yes, I think that actually was a big eye opener. Just having that experience at Iowa and undergrad, um, kind of, I knew I wanted to keep going healthcare, but MD, I didn't, all of those years of college, I guess that didn't really excite me. But the PA program is a good master's degree. I get to do similar stuff as a physician, so that was the route I decided.
So over, the last few years of your career, what's been the most unexpected change for you?
Yeah. I would say this COVID-19, as most people, has probably been a huge unexpected change for everybody. But for me in particular with this telemedicine, so it pretty much flipped our clinics. So our clinics went from being busy, busy, busy to nobody there. And so we had to act quickly, to just because to get our providers, patients, and really the other component was how do we take care of patients in the community quickly in a safe and effective way. So since March, this has really been a huge turn, which we've grown a lot, we've learned a lot, we've been really flexible with this, which we've had to be. But I think we are providing good care for not just locally, but for the state of Iowa. We have people call in and video in from anywhere in the state with us.
So obviously the pandemic has kept you busy, but what tips do you have for managing stress and just kind of your favorite way to practice self-care to manage the stresses of your job and just to kind of keep that work-life balance?
Yep. Yeah. So for me, in college, kind of my way of managing stress in PA school and undergrad was I like to listen to music. So just listening to music was kind of my way to just relieve stress. Um, Now more so with work stressors and COVID-19, just finding time to, try to take time out of the evenings, just to be with my family, the weekends. I try to give myself, try to do one full day when you don't do any work related stuff, which can be hard, when you're in an administrative role, your emails always are piling up. So I try to take a day, usually it's a Saturday, to enjoy Iowa basketball or Iowa football and just kind of get away for a little bit if we can. So I definitely encourage that. Take that time because you need it. That's kind of you need those mental breaks.
So how do you motivate the people that you train to just, stay motivated and things aren't great, but you got to keep going. So how do you motivate them?
Yeah. So I think with everything as fast paced as it is, so with these telemedicine, there's lots of changes. So guidelines, as you guys have probably heard and seen, stuff changes frequently. So I guess as part of that, our communication, so my communication to the providers is really email, since a lot of them are working remotely or in multiple clinics. So I try to keep things positive and lighthearted as well, just through emails or when I'm rounding through the clinics, just out talking to the providers, even just trying to, for a few minutes, if I can help them not focus on things and just talk about, how are they doing in their daily lives? How are their kids doing? So sometimes you just need to take a few minutes and talk to people about other stuff because it is stress, um, as we all know. Yeah.
Absolutely. Well, we're just about to wrap up here. Thank you so much, Robert, for joining us today. This
Yeah.
was extremely insightful. I'm sure our volunteers appreciate it. So thank you so much.
Thanks, guys.
So Robert, you should have a separate link on your Outlook for the SLB questions. Oh, did he already hop off? There he is.
Okay, I'll get on there. Thanks.
Perfect. Thanks. Bye, everyone.